Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. In studio today is Mindy Bolton. She's a creativity coach and dementia care practitioner, utilizing improvisational theater techniques, dance, music, literature, and even visual arts in order to engage those who are living with dementia and or Alzheimer's disease, and also to coach those who are giving care and some techniques that may be kind of out-of-the-box thinking. Good afternoon, Mindy.
Thank you. Yes, good afternoon to you.
You're a creativity coach. Talk about how you became a creativity coach, especially one who's dealing with dementia patients.
Yeah. Well, as I was studying community arts at Concordia St. Paul in Minnesota, I also was working in a variety of care environments. And I started to pick up on the fact that what I was learning could partner greatly with care environments. And I've been working towards that ever since.
I'm thinking, is one or the other more of a passion for you? As far as art, I've done a couple of acrylics, in my time. That's about it. But you were studying art. Do you consider yourself an artist who's a creativity coach, or a creativity coach, dementia care practitioner who happens to be an artist?
Yeah, this is a good question. And I would say that it changes, but my main distinctive passion is helping others. And I find that when I was in art school, I had a lot of colleagues and friends that they were really ignited by the idea of becoming an artist. Their name would represent the art they made. Whereas I always thought, I just think everybody's an artist. And I want to kind of tell everybody that. And so, like you said, I've done some acrylic paintings, but I would say what you do is an art in its own way. You know what I mean? With radio and connecting to others and looking at your information and displaying it a certain way. So I guess I'm sort of a progressive thinker when it comes to what is art and what isn't art. It all blends together. But I would say that my main passion is change making more so than creating visual art. I create visual art as a hobby.
Now, you've experienced a variety of caregiving environments. Do you think that being an artist contributes to being more mindful and empathetic, or is that something that is addressed in your techniques if a person is lacking in a couple of those areas, say mindfulness and empathy?
Yeah, I think that you could relate it to, I was on the track educationally to study art therapy. But what I realized about art therapy, we need it. We need it, and there are people that are good at it. And but I think there's a whole other sector of using art as a vehicle that isn't art therapy. It's more so connection-based. So I found that in the care environments I was in, it was a lot about critical thinking. And I realized that people were making decisions based off of things that were out of touch with the person who actually was living day to day, that were more numbers based and judgment based and logical. And I thought to myself, well, I've been around the people that we're caring for, and I don't know if this is their language. So it's basically been a way for me to start conversations and to bridge the gap between artists and more so the decision makers, I guess you could say.
It sounds like what your goal is, or at least a part of your goal, is to build a strong support group around those that are living with dementia and around those that are giving them care. Have you talked to any other artists who are not caregivers or dementia caregivers specifically, in order to maybe get them on board and some of their ideas as professional artists to help build this community? And my second question is, what type of reception have you received from doctors or professionals in the healthcare industry when talking about these techniques?
Right. It's a great idea, or a great question. What I do is probably 5% of my time, maybe 10, is as far as the work I do and the research and the connecting, is to identify artists who are specifically hoping to work with Seniors Plus. So there's an organization locally here in Minnesota called Art Stage, and there are a lot of different outlets and venues for people who do creative things to partner with care environments here in Minnesota. So I do a lot of networking through those communities. what I find is there is still, although research is coming around in explaining these creative techniques, there are lots of people writing books and doing case studies and things like that. And there are certainly people within the geriatric healthcare environment that are really recognizing the importance. I think sometimes it boils down to funding. A lot of times it boils down to essentially people, I think, that are definitely over 75 become particularly isolated. And so I think that, to be honest, a lot of people going about their daily life, and whether they're creative thinkers or business-minded or anything else, they tend not to always think about what is not in their direct environment. And so what I found is that's half my task right now, is getting people to think about it and care about it and wonder how it relates to them. And so that is what kind of the series of questions you just asked were wonderful in identifying exactly kind of what it is that I do and how my role is interchangeable. And I think that, Dr. Gene Cohen was a leading force when it came to creative aging. He's got a lot of great research, and there are people really picking up on it. It's just a matter of getting it, it's the proper funding and time. So right now it's a big sweet spot for volunteers to run art projects, and people are starting to think, well, we've had arts and crafts. How is what you're doing different? And so that's why it's good for me to be on shows like this, so that I can talk more in depthly about it, because it's a very dynamic thing, a lot of gray area.
Now, in wrapping up, Mindy, you're talking about visual arts, dance, improvisational theater, literature, music, things that not only an aging adult may be interested in, especially when the opportunity to unlock maybe some hidden talent or passion is involved, but these are some things that children would be interested in as well. In many situations, there are children involved while care is being given to, say, Nana or Grandpa or Uncle Joe. Do any of your techniques involve creatively thinking on how to coach children in understanding what's happening to their family member, and maybe even becoming involved in some of the quality of life issues that can be improved with these techniques?
Yes, I think it's intergenerational programming is huge. I think currently we have a lot of grandparents outside of the home. They're more so in assisted living because people aren't comfortable. A lot of people are busy at work and aren't comfortable being able to look after their loved one. And so by being in the assisted living, they sometimes have less access to children. And so there are tons of places that are now realizing, let's have the daycare close. Let's really make it a point to combine these groups. And I think that sometimes the challenges are having the time and the funding to make something that is really effective, because you can't simply take a group of children and a group of people with dementia and sort of just say, okay, mingle. You know what I mean? It has to be intentional and structured in a way. But yes, art is a perfect way to blend the two. And there's a big outlet right now for the creation of books that are similar to children's books, but they are made for older adults, and they highlight information for older adults that still supplies dignity and respect and isn't belittling their wisdom, but that is simple to follow, that children and adults can read together. So things like that are very exciting.
And direct our listeners to a website where they can get more information about you and about creative coaching as it applies to dementia care.
Yeah, I'm on Facebook. I'm on minnesotaartist.org.
All right. Well, Mindy, thank you so much for joining us today on Health Professional Radio. It's been a pleasure.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Mindy Bolton, creativity coach and dementia care practitioner, utilizing improvisational theater techniques, visual arts, even dance and music to engage those suffering with Alzheimer's and dementia in order to improve their quality of life. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.